Hello, today we're meeting a summit speaker, Dr. Jackie Montefiore. Thanks, Jackie, for chatting with me today.
Pleasure, Tracy. Glad to be here.
Awesome. So, can you just share with everyone a little bit about you?
So I'm a GP based in Brisbane, and I run my own practice called Sante Medical. Back before I went to medical school, I was previously a dietitian in my previous life, and so had a lot of experience working in a weight management clinic and a few other roles helping people with diet. And then as of the last, say, 3 or so years, came across the low carbohydrate diet, used it for myself, applied it to my patients, and saw some great successes in both of those. So I'm giving you the very short version of that, Tracy, because I know some people listening will have heard that story before, but let me know if you want me to elaborate at all.
Yes, please do, because the next question I have is, why are you so passionate about low carb? And it does generally, for most of us, come back to a personal story. So, maybe a little summary of why it is low carb for you.
Yeah, so like for so many, clinicians in particular, I mean, obviously that's the point of view I'm coming from, but we tend to become quite passionate about it because we're schooled in a certain way of thinking about diet and helping our patients control their weight to reduce risk factors of different diseases and improve current conditions that they might have. But the traditional training is always, refer your patient to the dietitian to help them lose weight or prescribe a calorie controlled meal plan. And it's very much information given to us in that calories in, calories out paradigm. Never really touched on the whole hormonal influences that relate to weight control. Basically wasn't touched on at all in medical school or dietitian school. And so with the low carb information I came across a few years ago, obviously then that led me down to the hormonal aspects of why we tend to gain weight or why it's so common in our Western society. And the fact it's not just due to the majority of us suddenly becoming lazy and gluttonous. So it never really made sense to me that everyone would suddenly want to be that way. And so having this more hormonal paradigm of insulin resistance and insulin being a big driver of why people tend to gain weight, and also the risks of different chronic diseases that increase over time as people get older and more insulin resistant. And then just seeing so much of that improve by using a low carbohydrate diet is just stuff that you can't unsee as a clinician. And, we cop a bit of flack for what we do as low carb doctors and clinicians, and some of the other speakers at the summit might talk a little bit more about that. But yeah, we just can't unsee what we've seen with the improvements in patients' health and their feeling of empowerment. It's sort of, giving them the option, so not forcing it on them unless we're responding to them requesting for our help, but giving this as an option for them to follow to improve those metabolic markers and their overall health. So that's why I feel very strongly about it, just in the effects I've seen in my patients. And then, of course, also my own personal experience and my own weight struggles that were accumulating in my kind of early to mid 30s related to pregnancy and excessive weight gain in pregnancy and very near gestational diabetes. And my own struggles then with controlling that and losing that pregnancy weight, and then using then a low carbohydrate, higher fat approach for myself, which I found transformational in terms of ease of controlling or bringing that weight back to a normal weight for me without having to really think about it, just sort of having some set parameters in place, and sticking to those, not even super, super strictly, but sticking to them most of the time. And it's just been an absolute weight lifted off my shoulders personally, not having to constantly measure portions or count calories or anything like that, which is what I used to think I had to do to control weight, because I knew if I ate to my own satiety when including refined grains and carbohydrates and foods that would stimulate my appetite, I would gain weight. I couldn't listen to my hunger and full signals when I was eating those sort of foods. So eating this way is just so much, it's liberating. Even though some people will say it sounds restrictive, it's actually liberating, because you don't have to think about that sort of stuff all the time.
Yeah, absolutely. I completely agree. And the hormonal side of things is something that, is very interesting. I don't know that people necessarily understand what that means, because when we talk about hormones, I think most people think about sex hormones, because they're sort of the ones that get the talk and the play a lot. But of course, we're talking about here the metabolic hormones, which are insulin and leptin and ghrelin and all those things that, help us control weight and, hunger and fullness and all that sort of stuff. And if they're not working for us and they're not working properly, we're going to experience things like, severe hangries and, being hungry all the time. And as you know, never fully satisfied. It's amazing just how that can turn completely around when those hormones do get, balanced properly.
Yes, it's quite revealing. And look, it's led me really to look into those hormones. I mean, insulin is the big one, and it's probably the most powerful of those hormones. But there's a very complex interplay between the gut and our fat stores and our brain, and the communication between those entities is very complex. But at the end of the day, it comes back into a normal state when we're eating a diet that's appropriate for us as a species, as humans. And that just allows our DNA and everything to get back to what it should normally be. That's the way I look at it.
Yeah, absolutely. It's not very complicated.
Probably don't
when
even
you look
understand
at it like that.
medically exactly how it all works. Yeah, well, it is, but you don't have to dive into sort of test or try and explore or use wacky supplements and really complicated regimes to try and correct all this, because sometimes you need to, help the body in a few different ways if things are way out of whack. And sometimes they can be after decades of, not on purpose, but just innocently following guidelines that we're given, or adhering to our cultural norms, if you will, even with other non-diet related things like screens and that sort of stuff. But yeah, so oftentimes we don't have to kind of complicate things too much. Eventually, given time and the right food environment coming in, or access to the correct food that we need, then things will tend to get back to a status quo, I find, which is good.
Which is good. So moving on then, are you able to share a little bit about your summit presentation?
Yes. So my presentation topic, I feel really strongly about. It's a pretty vast topic. So I've still got my work cut out for me, because I'm still working on my presentation. And thank you for giving me that extra time, Tracy, boss. But it's about heart disease in women. And, certainly in the low carb world, we have heard a lot of really interesting information about, cholesterol, and it's really opened my eyes up to the link between diet and heart disease, and that it isn't the way we've been taught or led to believe, or still what the Heart Foundation tells us, which, of course, if you don't already know, is that saturated fat in the diet will lead to increased cholesterol, which will, increase your risk of heart disease. So at the end of the day, that's the main kind of dietary mechanism they propose, and that's just kind of common knowledge, really, amongst the population. But different people in the low carb sphere have presented information about cholesterol, and that just the fact that it's a far more complicated topic than what we've been led to believe. Even as doctors, we were taught that tip of the iceberg about cholesterol and the interplay of it with heart disease. And so that's been another, I guess, passion of mine, which is run in parallel to looking into health benefits of low carbohydrate diets, is trying to understand more about the role of, say, cholesterol in heart disease. And yeah, like I said, there's been a lot of great presentations done about this. So risks of heart disease in the context of having a low carbohydrate, higher healthy fat diet. But none have been done that address women specifically. And there's a few interesting aspects of heart disease when it comes to women. There's a few differences in men or compared to with men. And a lot of the studies on heart disease have been done in men. But in recent years, as in, even just within the last 10 years, more of the cardiology guidelines have tried to incorporate and address women, because women still have fairly high rates of heart disease. Like in terms of a cause of death for women, it's really up there as, still the leading cause of death, higher than that of breast cancer, for instance. But the pathologic process, if you will, that's causing heart disease or cardiac problems in women is different to that of men. So I'll be discussing some of those differences. I mean, similar to what some of us listening might have heard, insulin resistance is a very strong driver as well for women, as it is for men. Some studies even suggest stronger, like having a diagnosis of diabetes is even a stronger risk factor for women in terms of heart disease than men. But there's other unique aspects to remember for women with developing heart disease. So different events that might happen in pregnancy. Pregnancy-related hypertension, high blood pressure, preterm delivery. There's things like autoimmune disease like lupus and rheumatoid arthritis, which are more common in women and have a recognised association with cardiovascular disease, thought to be due to the inflammatory effect. But at the end of the day, heart disease in women, there's seems to be less caused by coronary artery disease. So plaques in the coronary arteries, although that can happen in women, but other factors come into play. And it's pretty interesting. And like I said, I'm still in the process of diving into it. But stress is a really strong factor, and depression. And that can lead to cardiac dysfunction in women, can also lead to some coronary artery disease. But this one paper I'm reading right now is talking about how it's better to call it ischemic heart disease in women, because it's not just covering the coronary arteries, it's kind of dysfunction in the heart tissue due to a number of different causes, and that could be inflammation and endothelial dysfunction. So it gets pretty deep, and I'm sorry if I'm using some kind of scientific terms, and I'll try and explain them more when I do my actual talk. But I think it's really important to recognise those differences between men and women, and the differences in risk factors from the traditional risk factors that we're always told about, and keeping in mind some of the other risk factors that are particular to women. And then I hope, and then women also present when they have troubles with their heart, they can present with different symptomology compared to men. So they won't always get the kind of crushing central chest pain radiating to the jaw or the arm. They can get funny symptoms like just feeling shortness of breath without chest pain, or even things like nausea and that sort of stuff. So that those type of symptoms can be more common in women, but could indicate a heart problem. So we'll talk more about those. And then always, whenever I do these presentations, I like to have some good take-home messages for the people watching, and what we should mainly focus on to reduce our risk, and what tests we should pay more attention to with our doctor, and how we can have that conversation with the doctor if they're very focused on cholesterol, because it is one thing, but it's definitely not the only thing to focus on when it comes to heart disease. So there's a lot I'll be covering, and like I said, it's still a work in progress, but I'll try and distill some of that science for everyone watching.
Fantastic. Absolutely can't wait to listen to that. It just sounds like it's so important and amazing, really, with what you're saying about the differences between men and women, that there's just not more people talking about this and getting this information out there. So thanks for choosing this topic. I think it's going to be excellent, Jackie. Can't wait to watch it. So excellent. Last little question for today is, what is your thoughts on whether low carb is sustainable?
Oh, well, clearly I think it's sustainable. I can speak from personal experience that it is, for about 3 years now. So look, I think when you ask that question, you've got to go back to kind of dive into what someone might mean by sustainable. And from a physiological, eating when you're hungry, stopping when you're full, not having to measure portions and that sort of stuff, it's extremely sustainable, because it's coming back to the most innate hunger and full signals in our body that we're designed to do. So nothing could be more sustainable than that. The problem, or the question with the unsustainability, comes from the food environment that we live in. So clearly there's a lot of refined carbohydrates still in our food environment. They're everywhere. When you go traveling, when you go to the airport, when you're less in control of the foods that you're eating, yes, it can be a little trickier, or take a bit more pre-thinking and planning. So perhaps that's where the reputation of unsustainability comes from. So I get that, and I see patients who do well, previously, before coronavirus, did do a lot of travel related to work and whatnot. But so it takes a little bit more planning and thinking. But from a physiological point of view, I think it's very, very sustainable. And put it this way, it's definitely no less sustainable than, say, trying to follow the dietary guidelines and the recommended portions that are given, for meat serves and that sort of stuff. So I think it's more sustainable than that, because you're not having to constantly measure it. More sustainable, I think, than a vegan diet for a lot of people who might not, tolerate a lot of plant food, or solely plant foods, because of, their tummy might not tolerate it. So more sustainable than that. But again, vegan foods are more widely available, so in the food environment. So it's kind of a tricky question, but at the end of the day, I definitely think it is and can be sustainable. And with summits like this, and communities, online communities that can give people the support they might need to help them, because a lot of this, if it's completely new to someone, will just be completely like, how on earth am I going to do this? And I know people can feel very overwhelmed, but there's a lot of help available for sure.
Absolutely, there is. And just to give a little plug to what you and I do together, I mean, we have an online low carb lifestyle program designed to help make it sustainable. I mean, it is a long-term program, because I think, both of us have seen that change can take a while, and, having that support and that knowledge is really, really important. So, Jackie has it's her brainchild, and I just sort of come in and do a little bit of coaching. But the Sante Circle is
Tracy.
It's true.
Give yourself more credit, for goodness sake.
Well, I do love it, and I love doing this with you. I think it is such a great program, to help people, in making that change and bridging those gaps. And it's called the Sante Circle. So if you're interested in having a little look, I'll have a link to that for you to have a look at. And obviously Jackie will talk to that, and there probably will be a little gift if anyone wants to check it out from the summit. But yeah, and that's right. There is so much out there now.
Yep.
I've been in this space for 6 years, and it's changed a huge amount in that time, where there was virtually nothing 6 years ago, there is a lot. So again, it's just seeing that, there is there is a lot of change that you can get with how you see all this sort of stuff. So thank you so much for coming to chat today, Jackie. It's been great to introduce you to everyone, and I'm so confident your chat is just going to be, sensational, one to watch for sure.
Great. Thank you, Tracy. Great to be on. See everyone at the summit.
Bye.
Bye-bye.